Hello everyone. Today we will deal about acute pyelonephritis. Acute pyelonephritis. So what is the meaning of it? It is the bacterial infection. So to consider definition, bacterial infection leading to inflammation of renal parenchyma. And majority of the times it will be an ascending urinary tract infection. That is, often it will start in the lower urinary tract. Commonly cystitis will later lead to parenchymal involvement. So pyelonephritis. So this is very common, but bloodstream infections is very rare, very rare. This is especially seen in very immunocompromised individuals. So seen in immunocompromised. Now, whenever we see or whenever we suspect pyelonephritis, first decide whether it is complicated or uncomplicated. So when do we say complicated UTI or complicated pyelonephritis is? Suppose the patient is pregnancy, or any anatomical deformities. And here we have to remember that extremes of ages such as very young age and elders are at risk of developing anatomical deformities, which can lead to pyelonephritis. Then suppose the individual is immunocompromised, we can think it as complicated UTI. And one more situation will be prosthetics related, especially catheter related UTIs. We can consider them as complicated. All other things are uncomplicated. And one more thing is male UTIs are also considered as complicated only. So in uncomplicated, usually female of reproductive age group, who are sexually active, are at risk of developing urinary tract infection. So usually it will start as cystitis and ascend up to the pyelonephritis. So this is very important. Then comes what might be the organisms, microbes causing UTI. So most commonly it is E. coli. Then other microbes are Klebsiella, Proteus, even Enterobacter. So all these are belonging to gram-negative bacilli. And one more thing I told is, suppose the infection is related to catheter, we have to suspect cons, that is coagulase negative staphylococcal infection. Cons infection, they are gram positive. And how does they present? The individuals who have developed pyelonephritis will present with. So clinical features are, usually there will be fever, abdominal pain, especially flank pain. Then there might be associated nausea, vomiting. If the individual is elder, they might also have altered sensorium, even septicemia. And when we examine, there will be renal angle tenderness. So these are the features. And if there is cystitis, which is often seen associated with pyelonephritis, there will be dysuria and there might be hematuria also. So these are the clinical features. So when we get this case, we have to send some investigations. That is, important thing is urine routine, in which we will observe for presence of pus cells, pyuria. If there is frank hematuria, consider renal stones as the risk factor leading to anatomical deformity leading to pyelonephritis. Then we have to get urine culture sensitivity, then complete blood count and RFT. Why RFT is important? Because suppose there is acute kidney injury, or if the individual is already a known case of chronic kidney disease. So both are considered as complicated. So here one more point to add is any AKI or CKD patient comes under complicated group. That's why RFT is very important. So these are some investigations which we can consider. And when it comes to imaging, CT with contrast is the investigation of choice. CT with contrast. But few will prefer USG also. The thing is, majority of the findings will not be visualized easily on USG, especially renal stones. So these are the things about investigations. Coming to management, the choice of antibiotics here is, as just now we discussed, common organisms are gram negative, and if the case is uncomplicated, we can use cephalosporins for 10 to 14 days. Suppose the case is complicated urinary tract infection. Here we have to consider IV piperacillin tazobactam, piptas, or meropenem, or fluoroquinolones. But here one thing is, when we consider complicated, if the individual is elder, careful with fluoroquinolones because it will lead to tendon ruptures if we use in elderly. And if the individual is a case of seizure disorder, fluoroquinolones are known to decrease the threshold for developing seizures. So these 2 points have to be kept in mind. So these are the antibiotics of choice. And here one more important point is, students or practitioners often use nitrofurantoin. But the problem is, this medication will not penetrate renal parenchyma. So it is of no use in case of pyelonephritis. We have to remember this. This is one of the commonly misused medication in medical field, nitrofurantoin. So this is all about pyelonephritis. And especially if the individual is diabetic, we have to be carefully watching for emphysematous pyelonephritis. So again, CT will help in this case, and we have to consider partial nephrectomy in this situation. So this is about pyelonephritis. Main thing is, we have to choose antibiotics rightly. That is the important consideration here. Thank you so much.